Hello, and welcome to Voices in African Health. This is a podcast where we explore the big questions shaping global health and connect them to realities across Africa's health systems, hearing directly from the people driving change. I'm your host, Sharon Quntai. Today, I'm joined by Mouna Belkhayat from Morocco. Mouna has been deeply involved in global health work, overseeing projects across African health. I'm thrilled to have her here to share her insights. Hi, Mouna. Welcome to today's episode.
Hello. Hi, Sharon. Thank you for having me, and I look forward to today's discussion.
Amazing. Thank you so much for joining us. This episode is actually a way for us to give our listeners a sense of the conversations that are about to come. So we'll dive into a few questions. And Mouna, if you don't mind, could you please also share your perspectives around the questions that I'm going to share with you?
Sure. Thank you, Sharon. It will be my pleasure.
Great. So we can start then. So Mouna, when people talk about Africa's health challenges, what do you think often gets overlooked?
Well, what I think often gets overlooked is the huge divide between urban and rural areas. And it's not just about the distance to the health facilities. It's about a completely different perception of care. In rural communities, there is still a lot of work to do to break the stigma and cultural beliefs around health issues. And that's also directly linked to the issue of the medical desert, because a lot of doctors and healthcare workers are concentrated in the big cities, and this leaves many remote areas with a critical lack of trained professionals. As we're making progress with things like telemedicine, the core issue is human resources and training remain. So the people on the ground aren't always equipped to use these new technologies, and this divide persists.
That's really insightful. And I think it's interesting also because often the conversation around global health, especially, is very high level. But what you're pointing out is really what happens on the ground. And that's the main crux of this podcast, is for us to really hear what happens on the ground and to actually get the answers from the people who are on the ground. Also, we hear a lot about global health policy, but and I know for most people that could be a completely difficult subject to understand. But in your view, what does that actually mean for communities on the ground in Africa?
No, thank you for bringing this question. Well, we know that global health policies and their funds are incredibly important and have played a major role in improving access to care, especially for issues like malaria and polio. But the thing is, Africa is a massive continent with over 50 countries and thousands of communities, and all of these have unique challenges and needs. But unfortunately, these global policies are often designed as top-down approach. So they don't always adapt to the specific realities on the ground, as you highlighted. So this lack of flexibility means that they aren't always suitable and viable over time. So if we'd like for these initiatives to truly work and benefit local communities, we need to reverse the approach. And the approach should be a bottom-up one,
right,
with local leaders and governments actively involved in customizing and really taking ownership of these programs.
That is such a helpful perspective. And I think understanding those real-world impacts really helps people, especially people who do not understand global health policy, to connect the dots between policy decisions and especially the community experiences that are linked to global health policy decisions. So if you could change one thing in how health is approached in Africa right now, what would it be? What would that be for you?
That's a good one. If I had to pick one thing, I would probably change the overall approach actually from a focus on reactive treatment and infrastructure to one rather centered on prevention. Right now, lots of the effort is put into building hospitals, treating people after they get sick. And of course, this is very important, and this is where we need to start. But I also think that we need to put more energy into stopping people from getting sick in the first place, which means prioritizing training community health workers in remote and urban areas and empowering them to lead campaigns on things that really make a difference, like disease screening, maternal health and child health programs, vaccination, but also more broadly, improving access to clean water, hygiene, and good nutrition.
Those are such powerful points, Mouna. And I think it gives us a sense of where the opportunities for change lie when we talk prevention, especially considering the health issues on the ground. I think when we look at things from a prevention perspective, we really are going to make the right change that is needed on the ground instead of waiting for us to get to the point where now it's more of treatment. And also, when you pointed out access, of course, most people would know that in Africa, that's one of the major issues when it comes to health. So it really, really helps for us to hear where those opportunities are and how we can really change how health is approached in Africa currently. As we wrap up, I'd love to end on more of a personal note, seeing also that you've worked across many different parts of African health. Is there a personal experience or moment that has stayed with you since you started working in this field, one that really reminds you why this work that you're doing matters?
Yes, that's a good one indeed. And let me think from a personal indeed experience. What's I'm trying to think indeed about a personal, yes, actually, and I'm thinking about an experience that I had in my country. So in Morocco, a few years ago, going actually in a rural and remote area where actually I had to see indeed the challenges for young people to get to, as we said, these basic services, so the health facilities, and also like to get to school and to get really water, clean water. They had to travel like 3 hours in order to get to the closest points where they can go to school, go to health facility. And this experience actually made me realize that indeed living in an urban area, we are far from realizing how this can be a challenge on a daily basis for our people. And so living this and seeing this on the ground and working with these people to get there has been really an insightful experience, which showed me that it's really important to bring these local African voices and really, really bring these authentic stories to life. So yes, and I thought actually that with this podcast, I'm sure that you will help raise this and help raise these voices.
Absolutely. I totally agree with you, especially when you talk about what we see, especially in rural areas. And that's one of the biggest realities in Africa when you see issues to do with access and small things, like you said, access to things that are basic human needs like water. And you look at, of course, people living in urban areas, even though there would be challenges, issues like these are more of a concern than in the rural areas. So I think that's such a powerful way for us to close, and also a reminder of the human side of health in Africa. So thank you so much, Mouna, for sharing that. And this is exactly the kind of conversation that we hope to continue bringing to our listeners in the future episodes. So to our listeners, thank you for tuning in. This has been Voices in African Health. Be sure to follow us on Podbean, Spotify, and Apple Podcasts to stay updated and join the conversation. Thank you, Mouna.
Thank you so much, Sharon, for having me. I look forward to knowing more.